So is it necessary to remove ovaries to treat ovarian cancer, or without removal also patient can be treated?
See, ovarian cancer arises from the cells of the ovary, which may be lining cells, that is the above the surface cell is lining, or it can be germline cell ovarian tumor. Like there are cells which are forming the eggs. So these are the helpful in the fertility and all. That can there are two different types of ovarian cells. Whatever we see more commonly in the epithelial ovarian cancer rather than germline cancer. So anyway, whenever the tumor is there in the ovary, and if it is proven with a diagnostic test and blood investigation, it is proven, then most probably 99% of the time it would be required to remove the complete ovary. We have to do. See, if a patient is completed family, ideal surgery would be we not only remove the affected ovary, we remove the opposite ovary, we remove the complete uterus, uterine tubes, and we also remove the part of the lymph nodes on the either side of uterus. All the lymph nodes we remove, and then we remove fat of the abdomen, that is called omentum, and then we do biopsies of the peritoneum underlying the liver, underlying the spleen. This is the proper surgery to be done for any ovarian cancer which is diagnosed patient, because it has the propensity to spread other parts of the abdomen very rapid, and usually initial status only, that there is a possibility that there is a chance of spread there. So when we do everything, then after the report comes, we know what is the exactly stage, and based on the spread we give whether chemotherapy is required afterwards or not. Usually they will require chemotherapy, but there is always possibility of ovarian conservation, wherein if the patient is not completed family or not married, if she is having ovarian tumor, in selected cases, then we can save the opposite ovary, remove the only ovary with the tubes, and do the rest of the surgery, retain the tubes and retain the opposite ovary. But these are in the low risk, carefully selected cases, not every cases. And there is one more this, wherein if the patient is not suitable for removal of the keeping the ovary and survival, keeping the uterus, what we can do is we can remove both the ovaries and store the ovarian or eggs, ovum, and keep it a strip of ovarian tissue, cryopreserve it, so that the patient can have fertility in the future with either artificial IVF, artificial in this thing, or surrogacy. These are the options wherein the patient is looking for fertility with the ovarian cancer.